hospitals, and should there be a different system of quality control?
Absolutely. And, you know, we're talking about quality control. Do you realize how much money Medicare will have to spend on every single case that they debate, instead of using that money to debate a problem, come across with a plan that helps these hospitals, you know, help their care? I don't even understand this. And they talk about appeals. I mean, how many more appeals can we appeal? I mean, there is no way. There is a new policy where patients cannot be restrained. What will happen, and if anybody realizes this, that a hospital will have to say no patient can be admitted without a family member. Now think about that.
I'll let you gentlemen respond.
Okay. I can speak to some of those issues. The question is, what quality measures can the hospitals implement? Incidentally, the question isn't whether the doctors and nurses are doing their best, because they are. That's not the question. And there may be some confusion because some of these problems are blamed on the doctors or nurses. The problem is mostly the system in which the doctors and nurses have to work, in which these mistakes happen despite the best efforts of the doctors and nurses. As an example, that patient who got the wrong blood type heart-lung transplant, the doctor did everything right, but it wasn't his job to check the blood type of those organs. The problem was nothing in the system required that blood type to be checked for. Now, the Automotive Industry Action Group has proposed a equivalent to the ISO 9000 quality management system, which hospitals could implement, which would prevent most of these problems from happening. Also, back in 2004, Phyllis Mundy introduced legislation that would have rewarded healthcare providers for implementing these quality management systems. It passed the House, unfortunately did not get through the Senate, but had it passed, our local healthcare systems would have had a couple of years to get a leg up on this.
Well, but that's a different system. That would reward hospitals for having good quality control measures, where where Medicare says, we're not going to pay you. It's almost a punishment. If you've done something wrong, we're not going to pay you to do that second surgery or try to correct the problem that is caused by you.
But
exactly.
I think what Bill's saying is, if these quality management systems had been put in place in the first place, a lot of these events that Medicare is now saying we're not going to pay for wouldn't be occurring at all anyway. So they would have been ahead of the curve.
Let's go to the phones again. Tim from Mountaintop. Thanks for joining us, Tim. Tim, are you there? All right, I don't think Tim is with us at this point. We talked about the potential savings. The Bush administration estimates it's going to be $20 million in a $400 billion Medicare budget. You say that's rather conservative, but if it's more, the concern is watching where the money will come from elsewhere. Will they charge patients that have regular insurance that are not Medicare patients? But also watching this is the insurance industry, because the private insurance industry is considering implementing a similar program.
Well, I mean, I'm certain that private insurance carriers are going to be looking very closely at this Medicare initiative and seeing if they can then follow suit and do something and have private carriers do the same kind of things to prohibit payment for certain types of events and hospital-acquired infections and so forth that actually run up the cost for all of us who buy health insurance to pay for the continuing care of people who are injured in a healthcare setting or who acquire an infection and require an extended hospital stay as a result of that. It costs billions and billions, tens of billions, probably hundreds of billions of dollars in healthcare spending every year. And it's wasted money.
Do we have numbers on how much it costs across the board?
Again, 30 to 60 cents of every healthcare dollar. To put that in perspective, I did the calculations for General Motors, which is complaining about how much healthcare is costing them, both for employees and retirees. I calculated that it cost them $2.65 to $5.30 per share of their stock in poor quality healthcare that doesn't benefit their employees, doesn't benefit their retirees, in fact paying for hospital-acquired infections and other problems that could be killing some of their employees and retirees.
All right, they're playing the music. They're wrapping